Basically, when you're cutting all the nerves, what pain are you gonna feel? Today, we're gonna learn the difference between Botox and fillers. Some of you know that already, but some of you don't. So stay tuned to learn about what's the difference between Botox and fillers and other procedures that you can do into your face to make you look fresh and rejuvenated. The video is about to start. Don't forget to subscribe and turn on notifications. There we go! Hi everyone, and welcome back to another episode of Gustavo's World. Today we have, of course, your co-host Burbujita. Hi everyone! But the most important thing is that we have Dr. Carlos Medina. He's a plastic surgeon here in Miami. And I wanted to make a video about the difference between Botox and fillers and the other things you can do in your face, because a lot of people, they see somebody with a weird face and they're like, oh my God, she has or he did a lot of Botox. Well, in reality, Dr. Carlos is going to talk about it. And Dr. Carlos Medina was so grateful that he gave us time on his busy schedule, and here we are with him. Hi, Carlos. How are you? Welcome back.
Good on you. Thank you.
Great. Let's talk about you really quick. So, what do you specialize in? Where do you operate and all that stuff?
Yes, so I'm a plastic surgeon here in Miami, Florida. I have two offices, one in Aventura, one in Miami. Basically, I do cosmetic surgery. Also, I do like plastic and reconstructive surgery for patients that have cancer or like they have injuries. But, things like Botox and Juvederm, they've been around for a long time. For the last 19 years, I've been working with fillers, with Botox, and you hear people all the time saying like, oh, I need like some Botox for my lips. And really like, you don't put Botox in your lips.
Unless you want to frozen your lips.
Yeah. So basically, I can explain a little bit what is the role of each one of them and where do you use them in the face. And then that way people have a little bit better understanding of where to use them, how to use them. One of the things is with fillers and with Botox is people feel that if they do it, they will look young for a long time. And that's inaccurate. A lot of these fillers and Botox, they don't last long. Botox, for example, it only lasts anything between 4 to 6 months. And fillers, depending on which one it is, it can last a year. Some of them, they can last 2 years, 3 years. There's some special ones that they can last a little longer. But basically, it's not an investment that is going to last you 10, 15 years. It's something that you need to have a budget for and something that may need to get repeated if you want to keep looking good. Because if you only do Botox, for example, once a year, you will look good. But then within 6 months, you'll be back to where you were square one before you get it done. So starting with Botox, what is Botox? So Botox, what it is it's a paralytic agent. It makes your muscles not move.
It's a what?
Paralytic. It's basically, it immobilizes your muscles. So for example, normally the most common place that we use it in the upper part of the face, like from the eyes up. So basically what you're trying to get off is the muscles that they give expression to like paralyze them so you don't get wrinkles. For example, if you're like all the time like looking surprised, you will start getting wrinkles in your forehead. Or if you're squinting all the time, you will get wrinkles around your eyes. So those are the areas that normally you inject Botox. You inject Botox lateral to the eye or in between the eyes or the area of the forehead. That procedure usually gets done in the office. It lasts like 10 to 15 minutes, it's short. And it will last anything between 4 to 6 months depending on the person. There's some role of Botox on the neck. There's some people that have what we call platysmal bands. It's like the bands that you get when you're like...
They get what, Carlos?
They're called platysmal bands. It's like when you smile, they get bands in your neck like this.
Oh.
So when people are getting those bands and it bothers them, you could do Botox on those bands and it will make your neck be smooth. But most of the time, you're injecting the Botox in the upper part of the face. When you're going to talk about fillers, basically they're meant to replace most people if you look at pictures of you when you were like 15, 20 years old, you will look at your face looks a little bit fuller. Once years pass by, as you decades pass by, you become 30, you become 40, 50, you will notice that your face will start looking thinner, and you will start getting lines when you're serious. When you're serious, you will start seeing lines of expression in the nasolabial area, or what we call marionette lines. They're like at the end of your lips going down. Those lines, they happen in our face because for some unknown reason, as we go over 30 years old, we start losing fat under the skin of the face. So that's what a filler, you're filling the fatty tissue that you're losing. So you're trying to become fuller. So basically, besides replacing volume along the lines here and around the lines here, one of the most common now is like people want to have bigger cheeks. So a lot of times you can inject the filler a little bit deeper where your cheekbones are. So when you smile, you have like a bigger cheekbone, like it looks like a fuller, like you did when you were younger.
Okay. And then also the typical ones are like the fillers for the lips, in which, as we know, for example, in Russia, they're going extreme.
Yeah, I mean,
it was very popular, right?
Yeah, it's been going on for a while. Initially, when it started 10, 15 years ago, people were trying to make their lips look young. So what they were trying to get rid of the wrinkles. So whenever they saw wrinkles in their lips, they would inject a little bit of filler to make their lips look fuller. Now, that has changed a lot over the last 8 years, 10 years. Mainly with this family, the Kardashians. So there was one of the girls in the family that have really thin lips, and they augmented the volume of her lips a lot. She became very popular. She has a really popular, cosmetic line. So a lot of the younger patients, they want to have this fuller look in their lips. So basically with the filler, that's done in the office, and you can pretty much choose how much volume do you want. Do you want to look a little bit fuller, or you want to have more a more fuller look that everyone will notice that your lips are a lot bigger? So that's more like the taste of the patient, and it gets done in front of a mirror in the office, and the patient says, you know what, I want a little bit more. Of course, fillers, they have an antidote. So for example, let's say that you would get a job in your lips with a filler, like Duvida and Radiase, and you don't like it after a few days, there's some medication that you can actually inject, and you can dissolve it, and it goes away. The only problem is you spend the money already, and then you have to spend money with the antidote. So you have to kind of make sure when you're getting it done, what is your goal? What do you want? Are you sure that that's what you want? Because it's going to cost money if you regret it later on.
So the question is, with this, the price the same as injecting the filler, or is it a little bit less? Or
I think it all depends. And for example, when you're injecting Botox usually gets sold by units, and really how many units you use depends on the area, of how much you're treating. For example, if someone comes usually just to get fillers around the eye, on the outside of the eye, that maybe you use like 20 units, 25 units of Botox. So that's half the price that if you use 50 units of Botox to treat this and your entire forehead.
Okay.
And then with fillers, the same. If I have a patient that comes in that she's 25 and she just wants fillers for her lips, usually it's a really small syringe. One of the most popular ones is called Volbella, or it could be Juvederm too. And we inject the lips, but it's a really small amount, so it's a lot cheaper than if someone comes in at age 60 that they want their cheeks more pronounced, they want to get rid of lines. So that person that is 60 years old may need 2-3 syringes rather than a small one that a 25-year-old is using. So that's when you see what do you want to get done in your face, and how much work do you need, how much volume do you need.
Another question I have for you, because I've seen a lot of people that they look kind of, I don't want to mention any names, but there is certain artists that they're older and they're afraid to do plastic surgery. So I don't know who convinced them that applying fillers which is not Botox.
Yeah.
The Botox is to like freeze the skin. The fillers are to fill the skin. So the point is, they put so many fillers in their face that they're starting to look like a little balloon with three, slots to speak and see. So that is really horrible. And, let's not lie to the patients. I'm not saying that you do, but, at one point, you either have to either age gracefully or get the knife, and then get a little bit, unfortunately, those are the two options, right?
Yeah, and usually, like, for example, like when you have a younger patient that is coming at age 30, 40, getting the one to look younger, a lot of times fillers is the most cost-effective way. There's less risk. There's no surgery or anything, and you can actually make them look younger with non-invasive procedures in the office, like Botox fillers. Now, when you're I have sometimes patients that come to me at age 70 or 65 coming for fillers, and they're so wrinkled up that when I see them, listen, the amount of fillers that I have to put in use so much that you're better off getting a facelift than spending on a filler that is going to go away in a year. At least if you get a facelift, it's going to cost you about the same or maybe a little bit more, but it's going to last you at least 10, 15 years. So when you divide the cost of the surgery for 10, 15 years, comes a lot better deal than doing fillers every year, that much volume that a person who's 65 or 70 needs. So, you have to individualize the approach, see what the patient needs, what they want. And sometimes also you have to see if the person is being realistic or what their goal is. I have patients, sometimes they come in that they want something done to look like someone else, there's another ethnicity, and that's impossible. If you're Hispanic and you have dark features, you're never gonna look like Brad Pitt. So it's really, if that's your premise, so I mean, it's hard, you need to be clear with the patient. Just listen, I think that's, you're not gonna be able to get to that point for what you want.
And then I also heard about something like for this area, when it gets too fat or too saggy before the surgery, you can get something called Kibela or something, which is not a filler nor Botox. What is that?
It's basically an enzyme that's similar to one that we have in one of our organs, the pancreas. What it does is it's called what we call saponification. It's like the term for like melting fat. And what you're supposed to do is that you're supposed to like inject small amounts of the Kibela through the neck on the areas that you want to treat. And then over a period of 4 to 6 weeks, that process of melting the fat is going to happen. Now, it's not like the fillers that you're going to see the effects right away. You're going to get injected and you're going to come out like nothing ever happened. And then it's something that you have to kind of patiently wait and see what happens over the next 4 to 6 weeks.
Well, I heard that you get swollen?
You get swollen because the enzyme is kind of melting the fat in your neck. So you get swollen. And then the swelling needs to calm down. Every person is different. There's some people that get minimal swelling. There's some other people that get a lot of swelling. And the problem with that is sometimes the downtime, right? What happens if you're a person that you're working with public all the time, like you are in your show, and then all of a sudden, like people are seeing you with your neck like super, some people are going to be like, what happened to you, Gustavo?
I would die, yes.
Yeah. So it's something that you need to tell the patient, listen, it's not invasive, but it will have a downtime, and the downtime depends on how your body reacts to it. You may get really swollen.
And then, for example, with people that has a lot of saggy necks, not, the ones that they go like a turtle, like a, how you call it, like a turkey.
Yeah, correct.
Yeah, so there is no fillers or no Botox for that, right?
No.
Or no Kibela, I mean, really?
No, probably at that point, like, having a procedure is probably more cost effective.
Yeah.
And than doing like anything, non-invasive. It will come out like doing something non-surgical will come out like a lot more expensive for the person, and it will last a lot less.
And I hope that everybody gets the difference between Botox and fillers are two different things. And now we know what to look for when we go and get something done in our face before you need your surgery. And if you choose to do it, whatever. When you do a plastic surgery on your face and they cut all over, they have to cut the neck because they have to pull, and they have to cut around your ears because they have to work under the muscle, and then they have to pull the excess skin. So the point is, a lot of people is afraid to do this because they say that it hurts. But I have many people that I know that they have done this procedure, and basically when you're cutting all the nerves, what pain are you gonna feel?
I mean, out of all procedures that I do, probably a procedure in your face is not as painful because you're just working with skin. From a plastic surgeon, usually the most painful procedures are the ones that you're either cutting or dividing muscle or stitching muscle. For example, when you get a tummy tuck or abdominoplasty, you're suturing muscle in your abdomen. So that's extremely painful.
Oh,
or
really?
when you do on a breast augmentation, that you need to cut your muscle in your chest to get the implant behind the muscle, that's really painful. But when you have something on your face, you're dealing most with incisional pain, it bothers because we have a lot of sensation in our face, and getting swollen in your face, looking at yourself all the time, so you get really stressed out about it. So, but it's painful, but I think more than anything, it's just there's a downtime for swelling afterwards. So you basically, when you're gonna have a surgery in your face, whether it's get your eyelids done, or you're gonna get a facelift done, or a neck lift, you want to have that you have the right amount of time that your surgeon is recommending you to recover. You don't want to get this done and go back to work in 2-3 days,
of course,
and then you may get even more swollen and then have issues healing afterwards.
Okay, so I know your time is limited, Dr. Carlos Medina, and just for you to know, people, Carlos, I've been doing his hair forever, basically.
Yeah.
Yeah, I know him since he was little bit, he was very small. So he's great. I know a couple of patients that he's done, and he does very natural results. He doesn't make you look like you were pulled. These people look very normal, very natural, and I highly recommend it. So Carlos, thank you so very much for your time. I know you're busy, and I'm gonna let you go back to work. And thank you everybody for watching Gustavo's World, and thank you for watching. Please don't forget to subscribe and turn on notifications. That's clicking on the little bell. Comment all you want. If you enjoyed the video, please give it a like.
Don't forget to subscribe to grow the community.
And also, don't forget to follow our social media. And if you want to go ahead and share this video in all your platforms, share the love. Till next time!
Bye!